Symplast has been transformational for me and my practice. And probably the number 1, 2, and 3 feature has been 24/7 anywhere access to my patients' records in terms of looking into a pre-op patient, a post-op patient, planning surgery, checking up on someone after surgery, trying to remember a patient that I saw with a certain type of procedure a while ago. I'm planning a procedure and I want to look at their op report. We've been in practice over 30 years and we never had electronic health records. And when we first got involved with Symplast, I believe it was about 5 years ago. I mean, the easiest thing in the beginning was that we used to do all this paper transcription of notes. And now we've really gotten a lot away from paper. We still have some charts, but we're trying to get rid of them. But going to much more electronic, and the whole point that everyone can access, anyone you want can access it wherever they are, whenever they are, and through their phone, essentially, which is, I would say that's the biggest selling point. I believe it is a true mobile platform. I'm not sure what a not really completely mobile, but my understanding is it is truly mobile, yes. Well, I always look at the schedule. I look to see what I have, what's coming up during the day, and start thinking about which patients I'm going to see, and try to plan out my day, my hours, what's going on. And then if there's a surgical case coming up, to just review that, review photos. Yeah, so I think it's, not necessarily lugging as many charts around, and traveling a lot lighter. And yeah, I think that's probably major. What would I tell people? I would tell people that it's created by a plastic surgeon. So it's definitely something that can relate to something that I do. They're responsive. They have a good tech support. We're beta testers. And so they're literally, it seems like every month or less or more, there's a new update happening. So it's a constant process of evolution, trying to get better and better. And I certainly appreciate that. I understand that there are bugs that happen along the way, and we've encountered some, and usually they're fixable. The support people are pretty responsive about getting that fixed. And yeah, so I think that's it's a great. I think it's a great EHR. First, I would tell you that that's almost universally something that people talk about. They talk about it in their reviews, having instant access to the doctor 24/7, which makes me feel much better because I can talk to them before I find out that I have a problem the next day in the office. So we talked about this a little bit, but it has to do with their facility with with electronic communication, cell phone, et cetera. So sometimes you have either an older patient or a patient that's not that familiar with the phone, or they don't want to use the phone. But as long as they want to use the phone, which is the majority of people that can't get the phone out of their face, I mean, the truth is that you can use regular text message, but it's not HIPAA secure, HIPAA compliant, as you state. So I always check on patients post-op, and they always get back to me. The secure messaging feature is universally a great aspect. And then for that matter, another thing that's very convenient, we never had electronic prescription before. I know a lot of offices, even without mobile EHR, have gone to that. Some have been mandated, like Medicare, et cetera. And I don't write that many prescriptions, but the basic ones that I write for surgery, it's so simple. I use the Dose RX, or Dose Spot, which is the ERX that you guys have worked with. So, I mean, I just did that today for a patient. I was doing surgery, and the patient needed something. Rather than waiting on the phone to talk to the pharmacist, just plug it in and send it, and it's great. So, so patients really appreciate that, and I appreciate that for convenience. I'm not retired yet, but if it got me to retire sooner, I would really like it. No, it's really, it's good because, I mean, I literally would sometimes run to the office. We're very close to our office, to check something out, to look at a chart, look something up, and I can do it from anywhere. Yes, we were on vacation in California. I don't know if that's good or bad, but we ended up seeing a few patients post-op over the phone. My staff was here, so we were able to check up on some patients, and definitely having access 24/7 and wherever you are has been, this definitely makes it, you don't want it to interfere with your life, but if the work part is less tedious, it makes it better. It's a good balance.